Hi, my name is John Holden. I am a physical therapist in Sonoma, California, and I would like to share and discuss the rotator cuff impingement syndrome of the shoulder. And the reason I'd like to put this out there is because I see it done a certain way all the time repetitively, and a lot of times what I'm seeing, people are making it worse and they don't even know it. So I hope this brings another view out there for you. And what I see a lot of times in a lot of different settings is people think they're strengthening the rotator cuff and they put their elbow to their side and they're doing their internal rotation like this. What happens, generally what you want is the rotator cuff, when it works properly, it's called a force coupling, it distracts your humerus away from the glenohumeral joint. And as it distracts it, it leaves room for your arm to raise. So as I raise my arm, my humerus is actually slightly distracted to help it so it doesn't impinge. So if you strengthen your rotator cuff, it's actually, those rotator cuff muscles are distracting your arm so that it can glide more easily. Now, the rotator cuff muscles do internal and external rotation. The problem is, so do your pecs and your lats. And when you're doing the internal rotation with your arm by your side, they put the bands, the TheraBands or tubing. Those muscles that you're generally using are your larger muscles, which is your lats and your pec. And they attach a little bit lower on the arm. And so what happens is those rotators, internal rotators, get a little bit stronger than the rotator cuff, and so you're actually causing compression. And so what I ask people to do is to see what works for you. If that's working for you, great. If you've got a muscle problem with your pecs or your lats, great, you're helping it. But if you really want the rotator cuff, move your arm out 45 to 60 degrees away from your body so you're not using your lats or your pecs as much. And then bring your elbow forward about 30 degrees. And then use your tubing and stick it up at an angle and down at an angle and do your rotator cuff exercises like this. They'll be weaker, so you want to do less weight, less resistance. I like 3 sets of 30 repetitions, so you're getting a lot of blood flow. And as you do that, you're strengthening your actual rotator cuff muscles. But you don't have to take my word for it. Try it. Do your normal exercises like this and then lift your arm and see how easy or difficult it is. And then do exercises like this. Do 10 of them each way and resist it. And then watch the difference. It's significantly easier. You get more glide after you've done the internal-external rotation in this position. And it just gives you that glide that you need. And it feels better. It feels easier. So try that at home and see if it works for you.